This conference will now be recorded.
Good morning, everyone. Thank you all for being here today. This is a re-recording of the presentation that was live on May the 6th. Due to some technical difficulties, we've decided to re-record so that everyone has a nice and a clean presentation. So thank you all for being here for our presentation today on understanding lymphedema and treatment options that improve quality of life. My name is Jennifer Wang, the president of Paradigm Medical. We are a national medical products distributor specializing in lymphedema, post-mastectomy, and orthopedic footwear and foot care products. We service all of Canada for the past 25 years, and we are headquartered in Toronto. I am very excited today to be introducing Cheri Hoskins, our speaker, who is joining us from Texas. Cheri is the president of Compression Done Right, a compression therapy company, and has over 30 years of experience specializing in lymphatic, vascular, and arterial compression. She has owned clinics across the United States for over 27 years. She was a director of the National Lymphedema Network and American Society of Lymphology, and is currently serving on LEARN's Ask the Expert panel. What is even more intriguing about Cheri is her personal story. Not only did she grow up with a mother who lived with lymphedema, she herself was diagnosed at the age of 30. This has given her a very unique 360-degree perspective on this condition, and I am very happy that she is here today to share her insights with us. So thank you, Cheri, for joining us here today. And I will use the opportunity to pass over the presentation to you.
Okay, in order for us to really understand what we're treating and what we're looking at, and as patients, is what is lymphedema? Lymphedema is the impairment of the lymph system. Our lymph system is what our venous system uses as a catalyst to remove all the garbage that goes into our body. So it's more of a venting area. So when you have it, it causes an accumulation of protein-rich fluid in the tissue, because all that trash that's supposed to be sent through the lymph system and out through the bowels and the kidneys now is collecting in the tissue. And that's very dangerous because it causes infections. And usually you see it in the arms and the legs, and it's chronic and progressive. Does not get better. What we can do with the biocompression system is we can manually and mechanically replace what's wrong with the body. So if you look at the picture on your right, you see a leg, and you see how bad that lymphedema is in that leg. That is elephantiasis. That's stage 3 lymphedema. But that was actually repaired by providing a pneumatic compression device by biocompression in order to remove all that fluid, take it back out, and back through the bowels and the kidney. It is actually toxic, so it takes a little bit to move. Next slide, please.
Thank you, Cheri. So given that Cheri is from the US, I will present this slide. I wanted to give everyone here in Canada just an understanding of what are the statistics here in Canada? What are the numbers? And this is a study that was performed by Dr. David Keats and Dr. Anna Towers. This was published in the Pathway magazine back in spring of 2017. Dr. David Keats and Dr. Anna Towers used data which was prepared by the Canadian Cancer Society back in 2009. And they extrapolated the data based on the population in 2017. So their estimate is that there's roughly about 1 million Canadians who have lymphedema or chronic edema. So it's a big number. That's roughly about 3% of the population. As you can see from that chart, the diagram on your left, the bulk of the chronic edema is related to venous disease, although the specific sort of percentage of breakdown is undetermined. But you can see there that it is the majority. As well, roughly about 57% is related to morbid obesity, 15% is cancer related, 8% is tied to disability or the patient being chairbound. And then 4% is related to non-cancer related surgeries. As you can see, only 2% of cases are primary, which means that they were born with this genetic condition. So that gives you a nice breakdown of the condition here in Canada, and it's very consistent with what we're seeing in the U.S. Canada is roughly 1/10 of the U.S. in terms of population, and they're seeing, in excess of 10 million cases. So it's very consistent there. I'll hand it back to you, Cheri.
Thank you. Just a note on the previous slide is, you see the rising numbers, and you see it in the U.S. It's not that we're getting more lymphedema as time goes on. It's that it's actually now being diagnosed because there's more awareness of lymphedema. So the rising prevalence of lymphedema in Canada, we also see in the U.S., and it's because it's being actually diagnosed. Thank you, Jennifer. When we talk about the etiology of lymphedema, again, we're talking about a mechanical breakdown of the lymphatic system that prevents the removal of that toxic fluid from the body, causing it to swell and harden over time. There's two categories of causation. You can have primary lymphedema, and as Jennifer pointed out earlier, that is rare. It's congenital or hereditary. And then secondary lymphedema, which is acquired, is what we see more often. It's chronic and progressive. We cannot cure it. We can only provide mechanical means of replacing what's wrong with the body. And that's what we do with biocompression systems. Management is crucial for these patients because if you keep that toxic fluid in the tissue, it causes all kinds of problems, staph infections, and can cause death. It killed my mother. Next slide, please. When we look at the lymphatic system, and this is a beautiful drawing that Jennifer put in here, we look at the fact that it protects our body from infection because it is the filter from the venous system that removes all the toxins. It facilitates fluid movement back into the tissue, the good fluid, and it's a one-way system. It again, filters all the toxins from the bloodstream. And when you think about it, if you hold those toxins in the body, then you end up with lymphedema. And what we're looking at now is Milroy's disease. Milroy's presents at birth. This is a child that is born with a lack of lymphatics or faulty valves. Now, when the child is in the mother's body, in utero, the mother's body pumps all the fluid for the child. But when the child is born, then that child's body has to take over. It's really traumatic to the child when you think about it as a baby. The lungs have to start working, the bloodstream has to start working, lymphatics have to call in, all kinds of things. And if the lymphatics are faulty, then that child starts to swell shortly after birth. Then you have precox, which is not as severe as Milroy's, but it's the same thing. Child was born with a lymphatic disorder, faulty valves. They can't, their body, their venous system took up for it until the body started changing. And that's usually around the age of puberty. It's like a child that goes out to play football or any kind of sport, and they've already had their physical to do that. In the U.S., it's required that they have a physical. But there is nothing that shows up on that physical that restricts them from their sports. So they're out playing their sports, and all of a sudden they collapse on the field. And they take them to the hospital, and lo and behold, they find a congenital heart disease that is not detected during any kind of physical that they went through. That's the same thing with lymphedema. Until it rears its ugly head, you don't know you have it. And then you have TARDA. TARDA is, and I have a slide, the slide here says, usually occurs after the age of 35. Well, the venous system has taken up for the lymphatics until, same thing, patient born with lack of lymphatics or faulty valves. However, the venous system took up for it until it wasn't as severe as precox or Milroy's, until the venous system started to age. Once the venous system starts to age, then it starts to break down. And it tells the lymphatic system, look, we can't do any more work. And because I have occurs usually after the age of 35, that's normally if you have a patient that hasn't taken care of themselves, they're a smoker, they don't exercise, they drink alcohol excessively, those kind of things. That's usually around the age of 35. But if they take care of themselves, could be 45, 55, 65, 75, and even 80 before they start showing any signs. And I know you've seen some of these patients, and you as a patient, those of you on this call or webinar, know friends that have huge swollen ankles. That is TARDA. And it needs to be diagnosed more often. Next slide, please. Some diagnostic features of just primary lymphedema is swelling that moves into the feet and hands. You get deep creases at the joints. You can have a square toe or a shovel toe, meaning that if you have a toe that dips up, I thought I had a picture of that. It dips up and it's squared off. That's a square toe or a shovel toe. Now, if you were to take the skin right there and try and pull it up, it won't pull up because it's so taut due to the swelling. That would be a positive stimmer sign. If you could pull skin up, that would be a negative stimmer sign. Next slide, please. We know that lower extremities, whether it's primary or secondary, are more affected than upper extremities. And it most often misdiagnosed. When we go to secondary lymphedema, we're looking at a ton of things. And this is just a few. It's the result of some known insult to the lymph nodes or lymph vessels or the capillaries. That could be surgical removal of nodes due to cancer. And that's what we talk about a lot. And when we're talking about lymphedema is we talk about cancer. But it can be, and we talk a lot about breast cancer, and it can be any cancer. Could be lymphoma, could be Hoskins, could be melanoma, could be prostate cancer. I don't know if you're familiar with Sam Donaldson, but he was a commentary on the news, and he had lymphedema in his leg as a result of prostate cancer. There are so many out there that have lymphedema as a result of cancer, but it's not just breast cancer. And then we have radiation therapy. Now, when you have lymphedema or you have cancer or anything that requires radiation, they radiate the nodes, the lymph nodes. And when they do that, it impairs them because they turn into hard little peas that are non-functioning. And then you have trauma. I'll give you an example of one of my patients. He was in his 20s, decided that, he was going to go out partying on the lake, and apparently had too much to drink, jumped off the end of the pontoon boat, split his inguinal area, the crease of his leg, and in doing so, it interrupted his lymph system, and he ended up with lymphedema in his leg. Then you have tumor growth of any kind. It can cause lymphedema because it interrupts the lymph system. Invasive procedures, which is any kind of surgery. We are built of a lymph system that are like tiny little peas that run all through our body, or pearls that run through our body. And any kind of incision from surgery, it could be a hysterectomy, could be a knee replacement, could be hip replacement, could be any kind of surgery. And I've treated many that have acquired lymphedema as a result of that. Venous insufficiency is our biggest culprit because the venous system and the lymphatic system run hand in hand. And if the venous system is inadequate or insufficient, then it's throwing everything over into the lymph system and causing secondary lymphedema due to venous insufficiency. Then we have morbid obesity. Anytime you have a morbid obese patient, or if you have morbid obesity, the fat cells enlarge. And when they enlarge, you could lose tons of weight. And those fat cells are not going to go down all the way. They've already impeded or blocked the channels, those little pearls, for movement of lymph fluid. And then we have filariasis, which is the third world country disease. We don't see much of it in the U.S. I've only had 3 patients, and they were coming from Africa or India. Next slide, please. On the left, and these are my patients, you see a patient that has had a radical mastectomy. She didn't get lymphedema right after her surgery. She didn't get lymphedema 5 years after her surgery because her venous system was taking up for it. 20 years later, she ended up with lymphedema like this. And her oncologist called me and said, what do I do? And she had cellulitis, and I said, the first thing we need to do is get her in the hospital, get her on some IVs, IV vancomycin, clear up the cellulitis, and then treat the lymphedema. And within 6 weeks, we were able, with manual lymph drainage and coupled with the biocompression system, she was able to raise her arm. She was able to open her hand that was atrophied. She gave me a great big hug and said, that's the same hug I gave my sister that I had not been able to hug in a long time. And it broke my heart. I've had many patients that have broke my heart with their thanks. And then on the right side, you see, this is a mission trip. This is in India. This is filariasis. And it's where a parasite enters the body in any given opening, and it feeds off of the lymph system. Unfortunately, the only way to treat that is to remove the parasite and then do what we call debulking, remove a lot of that tissue, and then treat the lymphedema. Next slide, please. When we look at the stages of lymphedema, if we could treat these patients early on, we'd be so much better. When we look at subclinical, which is what I call stage 0, those are patients that we know have had an interruption in their lymph system. They might not show any signs, but any patient that has had a removal of their lymph nodes, they have lymphedema. Their venous system is just good enough to take up for it. Next slide, please. Then we have stage 1. And this is where we really want to treat these patients so that we can get them to look the same and not cause any cosmetic changes. This is the accumulation of protein-rich fluid that you can already see because you've got visible swelling and you've got pitting with pressure. Pitting means that I can push in on that tissue right there, and it takes a little bit of time to come back to shape. In a normal arm, it comes back to shape immediately. And the reason you have that pitting is because you already have scar tissue building up inside those pearls, like I like to call them. And that scar tissue causes hardening, and that's what we call fibrosis. Next slide, please. Oh, I'm sorry. Elevation reduces the swelling at this point, and it is reversible, meaning that we can get this arm to look the same as this one in this hand if we treat it. if we do not treat it at this point, then it's going to move on to stage 2. And when we say reversible, we don't mean curable. We just mean we can get it to look the same. If we don't continue to treat it, it's still going to move into stage 2. This is irreversible. Now we've got this gentleman who used to play on the Dallas Cowboys, and he had knee replacements and ended up with lymphedema. Well, his doctor decided that, you know, we're just going to wait it out and see if it goes away, and called it just edema. Well, and that's another subject that we'll cover. At this point, it's irreversible, meaning that cosmetically, we cannot get those limbs to look normal. You have minimal pitting with pressure. And I'm guessing at this point, you know why. Because that scar tissue has gotten so bad inside those vessels that we can't hardly push in on the tissue, and it takes much longer to come back out to the regular size. And swelling does not go down with rest. And you continue to get that scar tissue buildup. Now, if we don't treat it at stage 2, then we're going to move into stage 3. Next. And that's what we call elephantiasis. And if you look at this leg, you do not want to go here because it gets worse and the infections get worse because all that toxic fluid is continuing to build up inside of the tissue. Now you've got gross swelling. There's no pitting at all. The tissue is so hard you can't even push in on it. And you've got this elephantiasis appearance of the skin. Now, when you look at this leg and you look down here and you look at what looks like little warts, those aren't warts. Those are called papillomas. Those are actual lymph vessels that have become so hard and so full, they start popping out of the skin. Now, you also have a venous system that continues to try and cleanse itself, so it's still throwing out lymph fluid. And what happens is because it has nowhere else to go, it starts coming out of the skin in the pores. So that's what we call weeping. At this point, as you can imagine, the legs are so heavy and so dense that the patient has decreased function. They don't want to go anywhere because if they do, because of the weeping and that fluid has a distinct smell to it. So they're just pretty much housebound. Next slide, please. When we look at treatment options, we look at medications, and we know they only help with complications. Then we look at surgical interventions, which are not curative, and there are many complications. Then we look at compression therapy, where we have complete decongestive physiotherapist, and I am a therapist, and pneumatic compression therapy. Combined with that, in-home use, the patient has a whole lifetime of being able to mechanically replace what's wrong with their body. It's the most effective treatment and the best management option available for these patients. It saved many lives because of the infection itself that these patients get, cellulitis, kills. And like I said, it killed my mother. Next slide, please. Then we have medications. Antibiotics. Patients should have those on hand all the time. Diuretics, possibly helpful in the early stages of lymphedema. And then we have surgical intervention. Now, there are some patients that have to have that because they've got huge, what's called lipomas off of their extremity. If we refer back to the young lady in India, she required debulking. And then we have some in the U.S. that aren't elephantiasis, but have huge lipomas, and it has to be removed cosmetically and for quality of life. So it does not improve lymph flow, but it is necessary in some cases. And then we have microsurgical resection. This one is funny because that is a shunt. It's like a surgeon said, okay, we'll put a straw, and that's what it looks like, inside the tissue and see if it actually flows. And it doesn't. So it's no help at all. And then liposuction, which is the new thing that is out there, is, you know, it looks good for maybe the first 3 to 6 months, but after that, the patient gets worse because there's many complications. Next slide, please. When we look at complete decongestive physiotherapy, we're looking at manual lymph drainage, which is a light touch massage combined with multi-layered compression bandaging. And we pay close attention to compression bandaging because it's like using a biocompression system. You have greater pressure distally, and as it moves up, the pressure is lighter. But you don't ever remove the bandaging until it's time to take it off. And then you've got meticulous skincare and exercise. Why exercise while bandaging or while bandaged? Because it increases the pressure in your muscle pumps, and that's what moves fluid. It's your calf, your forearm, your bicep. If you're bandaged and you're exercising, then you're moving fluid. And then at the end of treatment, we look at compression garments. Management and maintenance and continued treatment must be followed by this program to prevent progression. And we add pneumatic compression to that follow-up and that management. Next slide, please. Pneumatic compression. May have some experience using it, or you may have some experience using it in hospitals or clinics. The affected limb is put into an inflatable sleeve with many sections, which are called chambers. The pump compresses each section in turn, moving from the tip of the hand or foot to the trunk of the body. So what you're doing is you're actually moving fluid from a distal area, the bottom, all the way up to where it drains into the inguinal area. And that's what our body normally does. We're like a plumbing system. When you turn your water on in your kitchen, you're actually creating pressure in order and regulating it with the sink, with the handle. But underground, where the pipes are, the pressure is much higher. And our plumbing systems are engineered based on our body and the way that anatomically we're built. Next slide, please. When we look at the description of that, and we look at a study that was done by Dr. Shuba and Dr. Roxon out of Stanford University, they had a breast cancer lymphedema treatment center, and they wanted to use pneumatic compression in combination with MLD or CDP program. And their therapist said, and we're all taught this as therapists, that pumps are bad. And they said, well, there's no science that shows that, so we want to be the first ones to publish it. So they went to the Cancer Journal, and they said, if we do this, will you publish it? And they said, sure, as long as you've got your independent review board and everything's okay, you've got all your boxes checked, then of course we'll publish it. You're world renowned, and we know the science behind yours. So next slide, please. What they did was they took a group of patients and they did half an hour of MLD, and then they used a biocompression system for half an hour at 50 to 60 millimeters of distal pressure. Now, when we say, and we talk about pressures with a biocompression, and we say 50 to 60, that is the maximum pressure at the end of the fingers or the end of the toes. With every chamber moving up, the pressure gets lighter. So we use those defining prescriptions. And then they took another group of patients and they did an hour of just MLD and bandaging. And both groups were bandaged. Next slide, please. Oh, can we go back just one, please? What they found was that 45.3% of the patients using the biocompression with MLD received 45.3% reduction in limb size, which is great. And those patients with bandaging and MLD, and remember, bandaging is really important, received 26% reduction. Okay, next slide, please. It still wasn't what they wanted to see. So what they did was they said, okay, we're going to take the pump away from those patients that had a pump during outpatient therapy. And we're going to teach them how to do self-MLD, give them a compression stocking. And then we're going to take the patients that did not have a pump, and we're going to give them a biocompression system, and we're going to tell them to use it at 50 to 60 millimeters of distal pressure, an hour a day. They don't have to do self-MLD, and we're going to give them a compression stocking. So they both got stockings. One group had an hour with the biocompression system. The other had an hour with self-MLD. The group that had the biocompression system ended up with 89% reduction. And the group that had MLD and compression garments decreased in size by 32.7%, or increased in size. So they got bigger. And the group that had the biocompression system continued to reduce. Next slide, please. So we know that pneumatic compression is important both in the acute treatment and maintenance of lymphedema. And that MLD is essential, and the results of MLD is essential in the maintenance of lymphedema with a biocompression system. It improves the results. You know, compression therapy with the biocompression system, unfortunately, in rural areas, is the only treatment available for these patients. So it works really well standalone. In the study, treatment was tolerated well by all patients, and there were no adverse effects. We know that it's safe and effective for use at home. Next slide, please. Biocompression is the leading manufacturer of compression therapy for over 30 years. The technology has been widely adopted, sold around the world. Their innovative pumps and garment technology resolve all historical concerns, and backflow is not a problem because you have that non-peristaltic action, which is holding pressure distally, and as you move up, pressure gets lighter, but you never release that distal pressure until you reach the target area for drainage, which is for a leg, the inguinal area or the crease of the leg. An arm would be the axilla or the underarm. And it's approved by the Health Canada for the treatment of lymphedema and venous insufficiency. Next slide, please. This is what a pneumatic compression device by biocompression looks like. And it's really easy to use. It is technology smart. So it memorizes what your limb is and then provides compression based on that. It's gradient sequential, again, meaning that you're providing pressure distally, and as the pressure moves up to the targeted area, the pressure gets lighter, like turning on the sink in your kitchen. You get the garment in 4 to 16 chambers, depending on what your need is. If you have just an arm, you know, it's going to be less chambers. If you have just a leg, it's going to be less chambers. But if you move into a pant, then and you've got trunk involvement, then you're going to look at 16 chambers. Patients must be trained in their use, and they're provided by prescription only. It's required. And they're used 1 to 2 hours a day, depending on the condition of the patient. How it works. In a healthy lymphatic system, the body uses various muscles in order to move fluid. And that's what we talked about before. The calf, thigh, forearm, bicep. In a similar manner, the biocompression simulates and mimics the body natural muscle pump function. Biocompression combines MLD with bandaging, with exercise. You get multiple modalities when you're using one. Next slide, please. In Canada, you're provided with 3 different options, and it depends on your actual condition. You have a 2004 model, which is very simple to use. There's an on and off switch. All of these pumps do bilateral. You can do 2 limbs or you can do 1. The 2008, which again is a very simple pump to use. And the 3008, which is programmable. And generally, that's what you're going to want to use when you want to manually change the pressure in any given chamber. Usually with pants, I've seen a great deal of that. Next slide, please. When we look at the 2004, you're looking at, it's a great model. It's got 4 chambers. It's very effective. It's very lightweight. It's simple to operate. Like I said, it's an on and off button, and you've got a dial to adjust the pressure. There's a 90-second cycle time. That means that it cycles between chambers every 90 seconds. It's got a 3-year warranty, which is really pretty good. And you can do, again, unilateral or bilateral, meaning you can do one extremity. If you've got 2 legs, you can do both legs at one time. If you only have one, then all you need is 1 leg. Next slide, please. The 2008 is much like the 2004, only we have 8 chambers, and you've got a faster cycle time. Normally, I would suggest the 2008 for upper extremities, and then you also have the 3-year warranty, the ease of use, on and off switch, dial the pressure, unilateral or bilateral, 1 or 2 garments at the same time. Next slide, please. And then you have the 3008. This is my favorite pump. It's because you have 8 chambers. It's most efficient. You have a faster cycle time. Now you've got a pre-therapy mode. If you've been to therapy, then you know that they do a pre-clearing, and then they start the massage from the distal area and move up. Well, this pump does that. You have the ability to adjust the pressure in any given chamber. So, for instance, if you were using the pants and it was uncomfortable in the crotch, you could turn down the pressure. Or if you had wounds and you wanted to release the pressure over the wound, you could do that. Wouldn't be a good idea, but you could do it. It has a timer on it and a compliance meter. Now, you can turn the timer off if you want to. You've got more garment options with this pump. Again, you've got that 3-year warranty, and you've got the ability to use it either for one extremity or two at the same time. It's best for clinical use in advanced stages. Next slide, please. The clinical benefits of all of these devices is, 1, they work. 2, they're proven. They're non-peristaltic, and they mimic the body's lymphatic system. So you're mechanically replacing what's wrong with the lymphatic system. They're beneficial for primary and secondary lymphedema. They reduce pain and relieve any kind of dynamic edema. They promote lymphatic flow by moving lymph in the proper physiological direction, distal to proximal, like your plumbing system. I want to go back to dynamic edema for a second. We've had a lot of patients that have been paraplegic, and they've had dynamic edema. And these pumps work extremely well for these patients, and they relieve some of the pressure that they can build up. They deliver continuous flow. You can use them bilaterally, again, one limb or two limbs at the same time. And they provide effective prophylaxis for venous thrombosis. Actually, if they have a wound, they will heal a wound twice as fast rather than with just traditional wound care. And they relieve restless leg syndrome. In the NIH, the National Institute of Health, has a handbook on restless leg. And you will find in that handbook recommendation for compression therapy. Next slide, please. Selecting the right device. You have to ask questions, and you always do with healthcare. What stage of lymphedema are you? Do you have trunk edema? Meaning, or do you have swelling in your belly? Do you require individual pressure adjustments in each chamber? Is there an area that you might think you would need adjustment to? Is the pre-therapy mode important for you? What is your budget? Next slide, please. When we look at the garments, there's over 55 different over-the-counter garments that are available to you. That's arms, legs, pants, arm with shoulder, arm and chest, or vest, or both arms and a vest. Biocompression is the only one in the United States that actually makes a custom garment for patients that, for instance, if they're pediatric, they're morbidly obese. They also do patients for that are amputees, and they actually even do garments for horses. So they'll do anything, and this is one of the reasons why I use biocompression. The owner called me and asked me if I would provide why I wasn't using his pump. And I told him, I said, I want faster cycle times. Gave him a whole list. He called me and told me to meet him in New Orleans at Mid-Trade. He had something to show me. And I went, and he had a pump. It was a prototype, but it was a Biocompression 3008. And that pump has become very popular. And I'm happy to be a part of it. And then I asked him, okay, I have a patient that has chest involvement. Can you make a garment for me? He said, sure. And I cut out a t-shirt around a patient and sent it to him. And he made a vest. So, biocompression, they listen to people. They actually listen. And all of the pumps, all of the garments, they're constantly being looked at. And what can we improve? And that's what they do. Next slide, please. Pneumatic compression can be used over bandaging, over compression garment, over Una boots, over tuba grip, over stockinette. Just note that after pumping, make sure that your legs are cleaned and lotion is put on liberally, and redo any wound care dressings after pumping. Always wear light, loose-fitting clothing under the biocompression system. That's always recommended. But just to improve, and let you know that you do not have to take your clothes off in order to pump. You do not have to take your compression garment off in order to pump, because we know how difficult those are to put back on. You can pump with those on, but if you have a wound, make sure it's taken care of after pumping. Next slide, please. General guidelines for treatment. We always like to let you know that if you have an infection, if your extremity feels hot to the touch, if it's got a rash, if you're running a fever, stop using your pump and go see your doctor and get on antibiotics for at least 72 hours. Because remember, lymphatic fluid is toxic, and all infection travels through your lymph system. So once you're on antibiotics for 72 hours, you can continue using your pump. If there's any pain or cramping, please discontinue the use of your pump and go see your doctor. That's usually a sign that there's something else wrong. Venous ulcers or open ulcers, open wounds, as long as there's no sign of an untreated infection like cellulitis, they can use a pump. Next slide, please. Should you have congestive heart failure that's uncontrolled, pneumatic compression is not your treatment option. You should probably be in the hospital and or see your physician. If it is controlled, you can use a biocompression system at 40 millimeters an hour a day in a sitting or reclined position, but never lying flat. We don't want to push fluid up to your lungs or your heart. If you should have any shortness of breath, fullness in your chest, dizziness, discontinue the use and go see your doctor. Now, when we look at active cancer and it's for palliative care only, it can be used an hour a day at 40 to 60 millimeters, determined by the tolerance of the patient. Now, that protocol is put there, but for me, I give the patient the option of making their own determination as to what feels good to them, because it is palliative care. They have cancer, they've talked to their doctor has given them a choice, because cancer travels through the lymph system. Do you want quality of life or do you want quantity? The patient has elected quality of life because they want to spend their life with their family in a way that they can be comfortable. So it's whatever feels good to them. Next slide, please. If they have an active deep vein thrombosis or a blood clot, we do not want them to use compression therapy with a biocompression system, because that would actually move or possibly move the clot up to their lungs or their heart. But if they have had one in the past and it's resolved, then they can have or use a pump. DVTs, there is a pump that for DVT prevention, and that's normally for patients going into surgery, and they want to prevent a DVT, or patients in a nursing home that are laying in bed all day long. Then there is a pump for that, but not for a patient that has a DVT. It's DVT prophylaxis. Next slide, please. Pneumatic compression is absolutely essential for long-term care of primary or secondary lymphedema. It provides quality of life, independence, and daily treatment, even while traveling. There's actually a bag that you can order through biocompression in order to put your pump in for traveling. And there's you can get if you're going to Europe, of course you're going to need a plug that will transfer it, but they make one for Europe. It also provides high levels of compliance, and it's safe and effective.
Thank you, Cheri. So I'll take over this slide here. Coverage for patients is a commonly asked question. So I wanted to just highlight that a little bit for everyone today on the call. So there is good coverage for pneumatic compression devices here in Canada. There is coverage through provincial government insurance programs. The two leading provinces are Saskatchewan and Ontario. Saskatchewan, through the SAIL program, provides coverage for primary patients and as well for secondary patients on a case-by-case scenario. Through ADP in Ontario, there is coverage for primary patients. There's also private insurance coverage. This will depend upon your individual policy. So you would want to check that in terms of the amount and whether or not the insurance coverage, the company provides coverage. We know, for example, Sun Life and Great Life provide coverage, and the amounts vary depending, I've seen everything from, $2,000 to upwards of $10,000 or really no limit whatsoever. In terms of the category of where this product falls under, it would be deemed an extremity pump for the treatment of lymphedema. So that's what you're looking for. There's also local charities which will help support a patient to get access to this device. Given that this product is a Class 2 medical device, it is also qualifies for an income tax deduction. So you can deduct this expense on your income tax return. Further, this medical device is deemed zero rated, which means that there is no sales tax when this product is purchased with a prescription. So keep in mind, this is a Class 2 medical device, so a prescription is required in order to purchase it for home use. As you can see, there's lots of programs that are available to help support the acquisition of one of these devices. These products are used daily, and as Cheri mentioned, it is something that you will be using for the rest of your life. So when you look at the cost, it's quite affordable. You're looking at, on a daily cost of, less than a cup of coffee a day. So this is something to look at. These are a few things that you would want to consider when you're considering this option. And in terms of next steps, the next question would be from everyone, how to get a biocompression system. The number one thing you would want to look to first is to speak with your medical practitioner. You want to understand, is this the right option for you? Cheri had touched on some of the common contradictions and general sort of medical guidelines. So you want to have those conversations to see if any of those apply to you. Next step would be to get a prescription. All of these products require a prescription in order for you to purchase it. From there, you would want to contact your authorized local dealer. Some of you may have been invited by your dealer to attend this webinar, so feel free to reach out to them directly. For those of you who do not know who your local dealer might be, feel free to contact us at Paradigm Medical, and we would be happy to provide you with a list of local dealers in your area. Your local dealer is really the one who will help you through this process. They will help you determine, which device is appropriate for you. They will be instrumental in helping with measuring, sizing, and fitting the right garment. They will also be the ones who would be providing you with the training for use at home, and then help you field any questions about insurance and things of that sort. So make sure to reach out to them, and in collaboration with your medical practitioner, they'll be able to find the right products and garments for you. And lastly, feel free to contact us at Paradigm Medical for any of your questions. We are the exclusive distributor of biocompression systems here in Canada. You can find us on Facebook at Paradigm Med, or you can reach out to us on LinkedIn on Paradigm Medical Inc. Canada. You can also reach out to us at our website, www.paradigmmed.com, or don't hesitate just to give us a call or email us directly. We are here to serve you and any of your questions and your needs. So don't hesitate to reach out. With that, thank you everyone for participating on today's webinar. And thank you, Cheri, as well. We hope all of you found this informative, and we look forward to hearing from you. Thank you.
Thank you.